Well, I've had back pain for a long time, and I'm thinking now that it was started when a log came flying through the air and hit me square in the middle of my lower back.
So the log came flying through the air?
Yeah, so that big around, and it got me right in the middle of the back, and it came from about 1,000 feet up the hill. But anyhow, I had a back fusion, L3 and L4, and they told me then that the area above and below might do the same thing because they're worked more. Well, then I had a herniation thing that went up the middle of my spinal cord and pinched the nerve, and I was at level 10 in pain. So they had to go in and clean that up. Well, that was all 8 years ago, and now my back pain is starting again, and it's the vertebrae above where the fusion was, and it's pinching a nerve that goes across my back, down the side of my leg, through my groin, and down the front.
Do you feel pain right now?
All the time.
Okay.
And I've had epidurals, and a chiropractor was working on it now, and massage, and whatever, because males told me my chances of having a successful operation was less than 50%. But I'd like to find a way that maybe I can get better without having to be operated on.
Okay.
And I'm not. If I were younger, I'd like to learn how to do this. This is very, very interesting.
Right. Never too late to learn something new. No. That's right. Look.
You're all in the room learning it.
I'm 85 and I'm learning it.
She's 85.
She's learning it.
Oh, you're 85. I'm only 75.
Okay, well, listen. You're a teenager. Come on. She can learn it. You can learn it. Again, sequence therapy. Why don't you take that watch off, please? And I need your shoes and socks off to do this first. I'm just reminding myself that the healing power is a beautiful mixture of technology, doing techniques, and something beyond technology working at the same time. That's where it really comes from. So that's always good to remember that. So that's a polar meridian pair again. Kidney and large intestine. Kidney is 5 to 7 p.m., large intestine is 5 to 7 a.m. on the Chinese clock, so they're opposite. So we can treat them together. Where you could use needles or you could use microcurrent. Now you could just put needles in these polar meridian pair, but I'm just going to use all microcurrent because that's the nature of this seminar here. And if you look at your color chart, magenta is one of the key colors for the kidneys. It fills the kidneys and the adrenals. And it's also emotionally balancing. Deep breaths into your belly, please, best you can. Why don't you put your foot up here? So positive on the tonification point, which is kidney 7, and positive on the negative, on the sedation point, kidney 1. That's what's good. I started with the root treatment. Okay, now if you put your foot down. Now, which movement makes you feel the back pain the most? Is it sitting up and standing down, or walking, or twisting? Walking? Okay, well, let me have you do the same thing that Ken did. Is just take a walk there and back and tell me how it's feeling. And see if there's any improvement from when you came in or about the same.
I think it's much better. I had that dull ache down there, and I don't have it.
Here, why don't you speak into the mic, please?
I think it's quite a bit better because I have a dull ache here that just gets to me by the end of the day.
So it's better than when you came in the room?
Yes.
Okay, turn this way, please.
Still got it right there.
Okay, so we're trying to quantify. Let's say if the pain when you came in the room was a 10 and 0 is total relief. What are you down to from the 10, would you say? Just pick
Oh, I would say 6.
You're down to about a 6. Okay, that's about fair. Okay, so let's see what, that's step 1 of the sequence. All I did was root treatment. I haven't done anything symptomatic yet. Because again, when anybody is 70 and above, I assume they need root treatment. If you get caught in the trap of just trying to fix pain symptomatically, you're going to limit what you can do. You've got to remember root and branch. Just so we follow the sequence exactly, I'll start with circling the dragon. So I'm going to go to reset, just go to circling the dragon, and I'm going to take the magenta out. Magenta is mainly for the root treatment. I'm going to go back to purple, because purple is very reliable for back pain. Okay, starting at about 70%. And I'm going to put one here right on that dimple, she said, where the pain is, and one on her abdomen. So it's going right through.
Same side or cross?
Same side. You could really do it either way. I mean, you could be creative with this. There's no fixed way you have to do it. But I'm just going to stake it on the same side. Breathe deeply. Take another walk, please.
Feels quite a bit better. I still have that one spot.
So there's more improvement than from the first time?
A little bit, yeah.
A little bit better, okay. So now we've done circling the dragon, we've done a little bit of mushu. So we've done the bottom one and the top one so far. Okay, next would be polarized local distal, this spot here.
Right,
Ashi, right there.
right there.
Took her breath away. So this is about 60% to start out with. Went right off the chart to 100. That's 40% reduction in resistance in 6 seconds. Now, please.
I think I'm down to about 40% now.
40% of pain left?
Yeah. That one spot is really not wanting to go away.
Okay, so there's...
But there's been quite considerable improvement.
Okay, so just on that one spot.
Well, it generates, but this is where the worst is, right there.
So here's some, okay, what I'm going to do is I'm going to put one probe here, the positive right on this point. And you said, where's it come around to? Show me where the pain comes to on your side.
It's down to here.
Okay, so
Down here, down there, and down there.
you get into that groin point there and just touch it. And I'll just keep this one here. Okay, do that again. Press it again and let go of it again. Okay, that's all we need. We can pull that out. There. Yeah, good.
I just wanted to be sure I'm pressing the right thing.
Okay, so now, take another walk. Let's see what that did. You're sure walking better, right? Yeah.
I can feel that.
The last thing I want to do is, you could just stand right here, or just sit down if you find for right now, is the auricular micro-macro technique. Sometimes that does amazing things. So this is the area, this is sort of the sciatic area of the ear right here. Right underneath the triangular fossa. I'm also going to do the thalamus point, which is important for chronic pain, here inside the antitragus.
Did you go back to biphasic?
No, this is polarized. Negative in the ear. And the 0 point. And I'm also going to do the kidney point, but I'm going to go back to magenta. You can leave purple on that one, but the kidney point, because that's our constitutional point. Okay, That's all. Just take a few deep breaths. And with back pain, I've noticed there's a lot of delayed action. Like I would expect that whatever benefit she has now, there's a good chance she'll be feeling better tomorrow. So now take your final walk here of this demonstration and just pay careful attention to how it's feeling.
Up here, this doesn't hurt.
Yeah.
But down. It's moved down a little bit.
Well, that's actually called chasing the dragon.
Oh, okay.
Now, because I don't want to ask you to take, just robe, if you were in an office with a gown, you could actually chase it a little bit and go down there, but I think I'll leave it for right now. But so what percentage of improvement do you think you have? From 100%, like 10 when you came in, what do you think you are now?
70% better.
70% better. Okay. Okay, well, thank you.